Hi, my name is Jeffrey Garrett. I'm a nurse practitioner at OIC. I studied at Florida State University and I specialized in things viral such as HIV and hepatitis C. My role in research is as a investigator, and in the past I've worked in hepatitis C studies. We were very proud of those studies. Prior to that research being completed and the discoveries brought to market, people received chemotherapy to be treated for hepatitis C. The treatment was very rough, and there wasn't a large group of people that were cured by it. It was like 50%, but they went through chemotherapy side effects such as losing hair, having to take time off of work. Our new medications, because of research, usually someone takes a pill or two or three for 8 to 12 weeks. They have very little side effects. They continue to work, and their cure rates are up in the 98, 99%. So I'm really proud to be involved in OIC's research. One of the things that I'm most proud of, having worked at OIC, is to be involved in research for hepatitis C. There's nothing quite as gratifying as telling a patient that they've been cured from a disease that in the past was one of the #1 causes of liver cancer. There's just nothing like that warm feeling and that bond that you get with a patient when you're able to tell them that they've been cured. I think that gay men still have stigma around sexual health because we've always, the healthcare system has used words like promiscuous, judgmental terms in dealing with us, especially in the early 80s and 90s. And I think that that stigma sticks. Instead of being considered sexually active, we're looked down upon as being promiscuous. HIV, well, in the 80s, it was considered a descent. There were no effective medications until mid to late 90s. And people were frightened. They weren't sure of how it was transmitted. Things weren't clear. We didn't have the internet like we have now. There was a huge black market for AZT. That was about the only thing available. That itself caused an entire group of side effects. There were not options, and people were preparing for their eventual demise instead of preparing for their life as a gay person. I think the first thing you'll find when you come to OIC is that we have an array of services, including specialized primary care. It's a little bit different than primary care in the rest of the healthcare world. We open ourselves to listen to the patient and provide you not with judgment, but with real tools that you can use to stay safe and still be sexually active. At OIC, we provide a large group of services. Of course, much is geared towards our sexuality because, let's face it, as sexually active people, the healthcare system hasn't been very friendly to us in the past. We've changed that, and you'll notice the difference when you come through our doors. It's important that you stay engaged in your sexual health care. We also provide weight loss services where we can assist you with your diet plans. We have pharmacotherapy that's available to help you lose weight. And in rare cases, we can even refer you for bariatric surgeries. That's another service that we offer at OIC. Of course, we've talked about the specialized primary care. We have some very good physicians and PAs and NPs provide care that's tailored towards your needs as a sexually active person. I think it's great that OIC is here for people. I think now one of the few places that a sexually active person can come to, be completely honest, not have to fear being judged in any way, but you will be given accurate information and address your concerns. I think that's the big part about OIC, is that it's a non-judgmental place that you can be treated with respect and have your sexuality respected. Healthy people who are sexually active need to know a few things. One, that it is important to test often for sexually transmitted disease and infection. It's also important, if you're going to be sexually active, to consider being on pre-exposure prophylaxis or PrEP, which is a medication that helps prevent HIV. It doesn't prevent other STIs, but with proper testing, those can be treated as well, especially with young people. You know, when you're young, you think that everything is always going to go just fine until it doesn't. And so this is a medication that you take, in most cases, once a day. It prevents the acquisition of HIV and allows you to feel comfortable while you're having sex. that you're not going to get HIV. Now, it may not protect you from some of the other STIs, but if you're engaged in PrEP with OIC, we're going to make sure that you're tested frequently and that you maintain sexual health. If you're sexually active, I think STI testing should be anywhere between 3 to 6 months, depending upon the amount of activity you have. Regarding human papillomavirus, or HPV, this particular virus can cause anal cancers, just like in females it can cause cervical cancers. At OIC, we routinely screen for this with something called an anal pap. It sounds very scary, but it really isn't. It's not as intense as a cervical pap for a female. But it is important to have it done because if we find things early, things can be treated before they progress to cancers. And so literally, anal pap smears help prevent the development of anal cancer. So that's why it's important. It's an important part of our practice. And luckily, we have a physician that specializes in a procedure called high-resolution endoscopy. He's excellent, and our patients love him. Even though the procedure seems peculiar, you'll feel right at home. It's part of a surveillance for your sexual health. Regarding the HRA, it's a high-resolution endoscopy. It's a small scope that the physician will enter the anal canal with. He'll be looking at it under a microscope under magnification so we can see any type of lesions that HPV may have induced. And we can make a decision at the time to take a little biopsy just to make sure it's nothing. But if it is, we also have treatments that we can bring you back for and actually treat that lesion without having to go under anesthesia, without having to go to a hospital or to a surgeon. Now, if we're there and we find things that are more complex, of course, we'll refer you to a colorectal surgeon. Any sexually active person over the age of 30 benefit from having an anal pap smear, both male and female. HPV does not discriminate on where it does its damage. It does it in both sexes.